Thank you, Southern Nevada, for making us your most watched newscast at 5 o'clock. This is News 3 at 5 with Jim Snyder and Jessica Moore.
Some doctors are calling it the new crack baby epidemic, the growing number of babies born dependent on painkillers.
According to a study published in the Journal of American Medical Association, the number of babies born suffering from withdrawal has nearly tripled in the last decade. News 3's Marissa Mike spoke with a local mom about her baby who was born addicted to opiates.
Talk to the experts and they'll tell you prescription drug abuse is a big problem in Las Vegas. Now it is spreading to a new generation. When expecting mothers take opiates, they are passing their drug dependencies to their unborn children. Some mothers say they don't have a choice and must take the risk of possibly harming their baby because they can't handle the pain.
Sofia Ungaro is 8 months old now, smiling cheek to cheek. But her first months after birth were not spent cradled in her mother's loving arms. Instead, little Sofia was whisked away by doctors. She needed immediate care for dependency on painkillers, forcing doctors to take drastic measures.
She had a tube coming out of her head, and I feel really ashamed of what I did, but I honestly had no control over it.
Sofia's mom, Alicia Ungaro, is a recovering addict who abused prescription pills throughout her pregnancy. After Sofia's birth, Ungaro learned her newborn baby was going through opiate withdrawal and needed drugs to ease the pain. A very tough way to begin a new life.
She was fussier. They can develop skin irritations, and she had a skin irritation.
Because of Ungaro's serious addiction, she lost custody of her baby. She's now working to become a loving parent so they can integrate back into society.
And it starts very innocently with a doctor writing a prescription, and before you know it, you're losing a baby.
The Ungaros are not alone. According to a recent study, by 2009, more than 13,000 babies were born suffering from withdrawals after being exposed to drugs, including codeine, even heroin, while in their mother's womb. It's called neonatal abstinence syndrome, or NAS. Dr. Joseph Adishak,
it happens every day,
explains the symptoms.
A baby is delivered. Typically, it could be cocaine, it could be amphetamines, and now, especially these days, opiates, where they will have a withdrawal syndrome. They'll have shakes, they'll have poor feeding, they'll have poor temperature control. They are going through withdrawal.
The number of babies born with NAS has nearly tripled in the last decade as opiate use among pregnant women has skyrocketed.
Most people don't start the opiates when they're pregnant. They get pregnant while they're on the opiates. So then what do?
Dr. Adishak says many local doctors are confronted by newborns dependent on painkillers every few days. But because the prescription drug abuse epidemic is so new, there are no concrete local numbers out yet.
The epidemic of drug use in pregnancy is way up more than it's ever been.
Temptation can be a hard thing, but I see where I am, and I'm with my baby, and that's where I want to be. That's better than getting high. Start the show.
Doctors say a baby suffering through withdrawal is completely avoidable if the mother gets off her pain medication before she gets pregnant. But there's an ethical dilemma for doctors. What should they do when a pregnant woman suffers from chronic pain? We spoke with a local woman in that position, and we'll hear from her tomorrow. Plus, is it justifiable for a doctor to prescribe pain medication to pregnant women knowing the baby's quality of life and health could be compromised? We tackle those questions tomorrow as some local doctors weigh in. That's tomorrow on News 3 at 5. Jim, back to you.
We will look forward to it. An eye-opener for sure, Marissa. Thank you. Hey, I'm